Welcome back. Summer fun has you busy and up on your feet, I'm sure. Now, if you thought of standing for too long makes you cringe, take steps in the right direction to ease that pain. Eliminate the feeling of walking on tacks, stop the burning sensation and those tingling sensations as well. And with us, Front Range Medical Center's chiropractor, Dr. Dean Anderson. He specializes in peripheral neuropathy. So let's start with that. A lot of people at home may not know what that is. What is it?
Well, it's damage to our peripheral nerves, which are the nerves in our feet, our legs. This can affect the nerves in our hands, fingers and hands, and usually it's a progressive condition. So it'll start off in the most distal area, most commonly the ball of the foot and the toes, and then as it gets worse, it'll start to work its way up the affected extremity.
It sounds painful, but so what causes this?
Yeah, well, there's a number of causes, and most people associate peripheral neuropathy with diabetes, but you can even see it with pre-diabetes. We see it as a side effect of certain medications. Certain chemo medications are known to cause it. It can be chronic use of statin medications. It can be a side effect of an autoimmune issue patients have. It can be because of liver or kidney problems. So there's a long list of things, and that's, one of the main goals is understanding why and what's causing it.
Now, when people are going through this, what exactly then are they dealing with? Other than that pain and some weird sensation, what exactly do they go through day to day?
Man, day to day, a lot of times what I see is it's a lot of frustration. Patients we see have been dealing with this forever. So because of the discomfort they have, oftentimes it's difficult to sleep at night. They can't be on their feet for long periods of time. A lot of patients, it can affect their balance because they have numbness, so they're worried about falling. It's difficult for them to drive because they can't feel the gas or the brake. And then a lot of patients deal with just hopelessness. They've been told, hey, you're dealing with this, there's nothing can be done for you, and they're told they just have to be on the medications the rest of their life, so they feel very lost.
Now, does this establish any sort of long-term complications for people at all?
Well, it can. Depending on the case, most neuropathies are progressive, so they do get worse over time. And as it progresses, especially with what we do, there can become a point where it's too progressed, and they're not going to respond to the treatment we do. So long-term complications are going to be just continued pain, continue to progress, and loss of function.
So what's your advanced treatment? Because you guys have really pinpointed this. It's super successful. Explain it to the viewers at home.
Absolutely. What we do in our office is the most advanced form of electromedicine. It's called electronic signaling treatment. Nerves are electrical. And so with this treatment, we use really high frequencies and amplitudes of current, and it treats the nerve symptoms patients are dealing with, the pain, the burning. Sharp shooting electrical pains will start to subside. Patients who deal with numbness will start to regain feeling. And as they regain feeling, they can start to have better balance because they know where their feet are in space. So it's really addressing the issue, which is the nerve damage and those nerve symptoms.
We actually are going to hear from one of their patients who found relief through Dr. Anderson.
I was at a point where a lot of my hope was gone as far as my feet were concerned and my neuropathy. Once I got over the skepticism of is this real or not, I just decided to try it. At this point, what could I lose? I had severe pain and numbness in my feet, and that started to go away quickly. And so I saw dramatic changes happen over the course of the treatment. My neuropathy is completely healed. I've seen an improvement of 90 to 100% over the course of the treatment.
720-851-9694. That's where you need to call to go ahead and get your free consultation with that. So, Dr. Anderson, are those the kind of results you normally see?
Yeah, typically when patients start off with treatment, after a couple treatments, they'll start to notice a reduction in pain. And so I always say, hey, the burning, sharp shooting electrical pains, those things will start to subside. And then as that subsides, one of the things that'll take a little longer is the numbness. They'll start to have better feeling and sensation over time. So it's typical with what we'll see. We look for patients to have, depending on severity, anywhere from 60 to 80% reduction in symptoms.
See, that's got to be nice. I would think that maybe even the numbness in some ways is even more frustrating because, the pain is there. You can do something. That numbness, it comes and goes, and so frustrating for a lot of people.
Absolutely.
So let's talk about the great special you have for our viewers. If this is something you're worried about or dealing with, you've got something for them out there.
Yeah, if people are suffering with neuropathy and they're concerned about the progression of it, we are offering a complimentary consultation where we can determine if they're a good candidate for treatment. And that consultation includes basically a sit down with myself where I can go through their history and start to get a better understanding of why they have it, what's causing it, complicating factors. And it also includes a neuropathy specific exam so we can make sure that the nerve damage itself isn't too severe. And this is what we need to determine if we can help.
That's so nice. For those out there who might be suffering with this or know someone that is, perfect time to call the number 720-851-9694. Your complimentary screening includes a review of your health history and a neuropathy-specific exam, like he said, to determine if this treatment is right for you. The number is 720-851-9694 or visit denverneuropathy.com. Dr. Dean Anderson paid for today's appearance.